recent study shows that the prevalence rate of hepatitis B and C is at 8.1% and 1.1% respectively. This shows that a lot of people are not aware of hepatitis, or they could even be infected and do not know they are infected. And of course, the consequences will be that they might also infect more people. Today on the program, our focus is on hepatitis. Plus, we have a short feature on hand hygiene. WHO, that's World Health Organization, says hand hygiene is critical in achieving a universal health coverage. All these and more this week's edition of Health Watch. My name is Nkem Okibe. We'll go on a short break. When we return, Health Watch continues. Stay with us. My name is Nkem Okibe, and you're welcome to this week's edition of Health Watch.
Those drugs are prescription only, and they are only to be dispensed by a pharmacist because we know how they work and we can save you from using it inappropriately.
But at least if you have a cervix, you have a huge chance of never having cervical cancer.
Lack of drug compliance, proper drug compliance. Probably the patient did not take it the way it should have been taken.
Glaucoma is the second most common cause of blindness worldwide, and glaucoma blindness is irreversible.
Before a dental surgeon practices anything, the ethics says a patient must go through a dental therapist.
Find out on this week's episode of Health Watch. If you're just joining us, the program is still Health Watch, reaching you on NTA Lagos Channel 10, the station for excellence. And before I went on the break, I told you that our topic today is on hepatitis. With me in the studio is Dr. Toyin Asaolu. She's a gastroenterologist and a hepatologist. Did I get that?
You did. You're amazing.
You're welcome to the program. Now, first question is, what do you do as a gastroenterologist and a hepatologist?
Thank you for having me on the show. As a gastroenterologist, I study and I take care of diseases involving the stomach, the liver, and the intestine generally. So we call it gastroenterologist and hepatologist.
Wow.
To specify what I do.
I'm sure that the viewer today would get to know what, when you meet the doctor that is in this field, you get to know what it's all about and what the doctor focuses on. Thank you so much for coming on the program. Now, back to the topic for today. What is hepatitis?
Thank you very much. Hepatitis means inflammation of the liver. We call the liver, in medical term, a hepatic organ. And we like to use itis for inflammation in medicine. So when we say hepatic inflammation, we mean that that's what we mean when we say hepatitis. So hepatitis is inflammation. Inflammation is response to injury involving the liver. Normally, if a mosquito bites you, you're going to have your skin being raised or red or itchy. That is your own skin's inflammation to the mosquito bite. So in the liver, when you have that response to whatever the injury might be, it is hepatitis. So hepatitis could now vary depending on the cause. If it is due to alcohol, we call it alcoholic hepatitis. If it is due to the person is not taking alcohol, the person is just maybe obese or taking a lot of cholesterol, but there's inflammation, you call it non-alcoholic steatohepatitis. If it is due to viruses, which are organisms that are specific for the liver, we call it viral hepatitis. So the viral hepatitis now, we have other causes of hepatitis, but let me now go back to the viral hepatitis. Okay. So the viral hepatitis is because of the virus causing the inflammation. So these viruses now, they are grouped under about 5. There are more than 5, but we use 5 terms to just differentiate them because even though they cause hepatitis, they are still different. So we have the hepatitis A, hepatitis B, hepatitis C, D, or E, depending on which one caused the inflammation.
Which one of the types is most common in this climate?
So in this climate, usually when we're talking about hepatitis in this setting or generally, they are likely referring to the ones that cause chronic hepatitis. Chronic means that it's going to last longer than 6 months. So we have like the B, the C, and the D in that category. The other ones, which is the A and the E, usually cause hepatitis but it doesn't last longer than 6 months. So we call it acute hepatitis. There's inflammation. The person responds by either having yellow eyes, having some signs of symptoms and signs of hepatitis, but it goes within 6 months. So we call it acute hepatitis. But the chronic one might not have any sign or symptom, but it stays longer than 6 months. So that is the hepatitis B, hepatitis C, and hepatitis D. Now, the hepatitis B is endemic in this environment. The C is also, to an extent, we have a lot here, but it's not as endemic, it's not as prevalent as the hepatitis B one. The hepatitis B is common in Africa because it is in the blood. It's also, the C is also in the blood, but the hepatitis B is usually when blood comes into blood through some sharing of shafts, sharing of needles, sharing of toothbrushes, scarifications, circumcision, tribal marks, all those things we do normally as Africans that we do at birth. So because of that, hepatitis B is more prevalent in our environment. Hepatitis C is more associated with intravenous drug abusers. So intravenous drug use, blood transfusion, so the prevalence is not as high as the one for B. The hepatitis D is the least prevalent because there's no hepatitis D if there's no hepatitis B. Hepatitis D is an incomplete virus that cannot stay on its own. So before you have a D, the person must first have B. So it's really, really negligible when in terms of prevalence.
Okay. So in your definition, you talked about the causes of hepatitis. I know you highlighted it, but I think you should also explain further. When you say causes, you talked about alcoholic. Probably you should explain further so people can get to know.
Because the liver is the largest organ in the internal part of the body. And the liver is like the gate man of the body. Liver is like the organ that does the function of detoxifying whatever comes through the stomach. So the blood from the stomach, from the intestine, goes straight to the liver first. From the liver, the body builds the energy from the food there. The body takes away the dirty one so that we can excrete it in our feces. So the liver does a lot of work in that respect of what goes in or what goes out. It also stores energy, so your glucose, you're not tired, the energy you use to work is in the liver. So because of that, anything that comes through the mouth will go through the liver first. So when I was saying hepatitis, I was saying alcohol, because yes, alcohol go through the mouth. It will cause hepatitis because if you continue to take a particular volume, more than the recommended for your sex or just for the gender per day on the age, the person can have alcoholic hepatitis. The same thing with other forms of hepatitis like toxic from herbal concussion, native concussion, all those agbo and all that we take. And I also mentioned that recently we are having increasing incidences of fatty liver from people that don't even take alcohol, which just because they are sitting, they are obese, their diet is too rich in calorie and cholesterol. They cannot have what we call fatty liver, which causes hepatitis too. So inflammation is just like what is stressing. I already said it is response to injury. So what is causing the stress at those things? We also have other causes, like sometimes it's from what you sniff, okay? Sometimes it's from metabolic conditions that are inherent in a particular person. Some people, they cannot store copper very well. Some people are storing too excess iron. Those people, they will also have hepatitis. So yes, there are many causes. And some drugs. So you're taking some drugs, it's causing inflammation of the liver.
Okay, is there a particular age group that is at risk of contracting hepatitis?
Everybody in Nigeria or all African countries are actually at risk because we stay in endemic environments. So any country that has more than 8% of their population or prevalence is termed endemic, and Nigeria falls into that category. That means we are all at risk. However, some people are more at risk than others. These are first people that share needles, people that share shafts, people that share objects, or people that are sexual promiscuity, sharing needles, sharing blades, circumcision, just all this indiscriminate use of sharps that we do. Because maybe you are just going, you call a barber and a bookie, come and barb my hair, come and do my pedicure. Those are the things that put people at risk. However, children, especially infants, are at risk of chronic hepatitis.
Why is that
So because they have a low immunity. So when they come in contact with this virus, they do not have the immunity to fight it off. So usually they end up having chronic. So we talk about 95% percentage chance of taking it to chronicity. So only 5% of them have a chance of overcoming that virus at that point by being sick, by just getting it out of the system. 95% of them will carry it in chronicity.
Okay, we'll go on a short break now. When we return, we're talking about the treatment and the prevention tips and all of that.
Yeah.
We'll go on a short break. Health Watch continues in a moment. Stay with us. If you're just joining us, the program is Health Watch, and this week we're talking about hepatitis. My guest is in the studio, Dr. Toyin Asaolu. She is a gastroenterologist and a hepatologist. Before we went on the break, we just talked about those at risk. I know that COVID-19 is taking a lot of attention now in the world and in the health sector. What would you say are the challenges arising as a result of the fact that the whole world, the whole attention is on COVID-19, and so a lot of other health issues are suffering?
COVID-19 has affected hepatitis in many ways, more than one. First is the fact that the attention COVID-19 has taken from the whole world is actually magnificent. We have seen a lot of people being hysterical, and because of that, we've neglected other conditions that have been pre-existing before COVID-19 started. The truth is that this is understandable. I'm hysterical, I'm scared. But it doesn't mean that the other problems are still not there. So we are encouraging people to not forget that. Even though COVID-19 is existing, we should not forget that people still need attention. Hepatitis infection still needs to be, we still need to do advocacy for hepatitis and to encourage people to get medical care. It's also important to note that because of COVID-19, people that have, people's access to other medical facilities have been reduced. First of all, a lot of people are under lockdown. They can't go to the hospital. They can't do their checkups. They can't do their scanning. They can't do your viral load. Right now in Nigeria, at the lab where we do the screening, they are overwhelmed with testing for COVID-19, so they can't even test for viral load for a while. So these things are affecting the viral hepatitis patient. So we need to make opportunities for people to be able to also take care of their underlying condition. Then if you are hepatitis positive, please do not forget that you still need to do your regular checkup. And don't forget that the hepatitis, either B or C, is one of the underlying conditions we are warning that predisposes to mortality in COVID-19. So we don't want you to be at risk of that. So please do not neglect your health. Also, if you're hepatitis positive, hepatitis B, hepatitis C, it is important that you still go to your hospital, you still do your normal checkup, because the virus itself, the COVID-19 virus, sometimes causes a reactivation of the underlying hepatitis infection. Some people, they have been issued, their hepatitis have been in remission. They are controlling it, is okay. But you see the virus, when they are positive with COVID-19, the virus shoots up. I have a patient that his hepatitis viral load became 170 million, thereabout. So these are one of the things COVID-19 has caused. Also, some people in trying to protect themselves have taken a lot of agbo, herbal concussion, ginger concussions and all that. And the liver that has been managing itself before, you're just going to stimulate it and cause another injury. These are the effects I want us to look out for. That's one of the reasons why we're doing this advocacy, to tell people that this COVID-19, protect yourself so that you don't be at risk either in the hepatitis infection area or into COVID-19 complications.
Okay, there's something we didn't talk about. You just mentioned that you had a patient that had 170 million viral load of hepatitis. So how do you know the symptoms? Are there signs that you should look out for and then you need to see a doctor?
For people with chronic hepatitis, usually, majority of people will not have any symptom if they have a chronic hepatitis. It is a silent destroyer. It is not showing anything. So it is only through screening. And many people have been lucky to find out that they are positive by screening. When they want to go and donate blood, that's when they found out. And which was actually, in a way, they were trying to be altruistic, but they are the ones that benefit from the altruism because that's when they found out they were positive. So many people will not have symptoms for hepatitis B. That's what I want everybody to go out with today, the information I want us to go. And for people, some people, the first time they are knowing, I had a 35-year-old banker, the first time this man was knowing that he was positive was a cancer.
So in other words, are you saying that you could have hepatitis
I'm not
for
sure.
years
Yes.
and you don't get to know, you don't feel any kind of discomfort,
Yeah.
and you're living with it?
Yeah.
How possible is that?
Because I said it the first time that the liver is the largest internal organ.
Okay.
So it can accommodate a lot of bullshit. Sorry to use that word on yourself. You can have a lot of whatever it is. It can take it. The injury, the insult. It can take it before it's making that noise. So that's why we don't bank on the liver. You look out for it first. Because it's looking out for everybody. It's big. Before it shows 80% sometimes of the liver function is damaged. So many people, and most people with hepatitis, got the infection as children. During maybe mother is delivering them, you're cutting cord. I didn't mention that. Cutting their umbilical cord. During that period, they can have it as children from their mom. And as they are growing up, child-to-child transmission. So we're living in the same house, we have injuries. I said if we share needles, we share others. So many people with hepatitis in Nigeria, in Africa, is through child to child. So they got it as children.
Okay.
So because of that, they might not even, and they won't show symptoms. Like I said, the immunity is low at that age. So you will not show the symptom that somebody that has immunity will fight the virus, they'll be feverish, they will have yellow eyes, which is what we call acute hepatitis. They won't show it.
Okay.
So that's why they go with it. They grow with it. And by the time they're in their third decade, fourth decade, they start manifesting the problems.
So is there a vaccination for it?
Yes, and there is vaccination. And there are vaccines to prevent it. It is the hepatitis B is vaccine preventable, but the hepatitis C has no vaccine. The hepatitis B vaccine is given at birth after 1 week thereabout for about 6 months. We have some that have compressed it to 1 month, and it is very, very protective.
All right, the big question now, can it be treated?
It can be treated, yes. Treatment for hepatitis B is non-curable, though. It's not curative treatment. It is a managing, so you manage it. By managing, studies have shown that the lower the load is in your body, the lower the enzymes in your body, the lower your risk of having complications. So our goal is to reduce the virus to the level that it is not even significant anymore. It's there, like I said, it's not curable because it imbibes itself into the DNA of the liver. So you can't get it out. So, but it is manageable. So you can actually manage it. And the management means that the virus is very insignificant in the person's body. On the other hand, the hepatitis C is curable. It is very curable. That's it.
I'm sure a lot of people out there don't like to hear it's not curable. So maybe we should also talk about how to prevent it, because they say prevention is better and cheaper than cure.
I agree. It is preventable, and that is why we talk about vaccination. That's why we talk about we're discouraging sharing needles. We're discouraging sharing sharps, sharing the barber's clippers or needle. When you go to your hairdresser, go with your own needle. When you're doing your pedicure, go with your own instrument, because it is don't go and take what is not your own and start getting stuck with a virus that is not curable. However, the fact that it's not curable does not mean that there is a problem, because some people will not be lucky to get this information before they found out that they are positive. The good thing about hepatitis B is that majority of people with hepatitis B Nothing will go wrong with them in their lifetime. They will be okay. The liver will be okay. Majority of people, like 60 to 80% of people with hepatitis B, will be fine. It's just that even though we know they will be fine, there will be some 10%, 20% of people that might have complications, and we don't know who these 10% are. That is why we are talking about everybody getting screened, and that if you're positive, being monitored, being assessed, so that we know what you need at each point, so that you don't have complications. But if you are positive, it is nothing to fret about. Go to a registered hospital, go and get monitored, get evaluated properly, and the doctor will advise you on what to do next.
Wow, thank you so much. Okay, for the viewer out there, a lot of things have been said today. First, you need to go for screening. You need to go know your hepatitis status. And then for those of us that take agbo, I'm sure you've heard what the doctor said today. Not good for your health. That is not good enough for your health, because it could affect your liver and you could come down with hepatitis. All right, thank you so much, Dr. Toyin Asaolu, for coming on the program.
Thank you very much for having me.
Moving on, our next feature is on hand hygiene. You will all agree with me that COVID-19 has increased the awareness on hand hygiene. Enjoy this feature. We'll be right back. Coronavirus is dictating the pace at which a lot of things are being done in the world today, with lots of precautionary measures put in place, out of which washing of hands is a globally accepted approach to containing the spread of the virus. In fact, the year 2020 will be remembered for the continuous washing of hands and also the use of hand sanitizer due to the pandemic, and this has increased the awareness on hand hygiene.
COVID-19, we have the good side of it, we have the bad side of it, we have the ugly side of it, the good, the bad, and the ugly. The good aspect of it is that it has ensured not just hand hygiene, but other personal hygiene, environmental hygiene. So as far as hand hygiene is concerned, with all over the places now, before you enter the supermarket, before you enter any religious worship center, in the hospitals here, everywhere you go, you must find hand washing buckets or running water or automated one before you are allowed in.
According to World Health Organization, hand hygiene is critical in achieving a universal health coverage.
Hand hygiene is the regular cleaning of your hands to ensure it is free of germs, so as to prevent the spread of germs, pathogens, microorganisms, and transmission or reduce transmission from one person to the other person, or from the patients to you, or from the contaminated surface or objects to you. It involves two major things: regular washing of your hands with soap and running water, or if you don't have soap and running water, then you can use an alcohol-based sanitizer.
Hand hygiene is the cheapest and most effective way of preventing and controlling infection. And one of the ways to control infection is by hand washing. When the hand is heavily soiled, we wash with soap and water. Otherwise, we use alcohol-based hand rubs. And this will go a long way in preventing and when it happens, controlling healthcare-associated infections, because we realize the burden of healthcare-associated infection is growing by the minute. It's not just about transmitting infection from one person to the other. It goes beyond that, because as a healthcare worker, you carry a lot of things from the hospital to your different homes and the community. So it's a worldwide thing.
Maintaining a proper hand hygiene would prevent a variety of diseases, including COVID-19. However, washing of hands alone will not prevent the spread of coronavirus. Let's continue to obey all government guidelines and observe all precautionary measures to flatten the curve. And that's the much we can take on this week's edition of Health Watch. Remember, that regular hand washing would help a lot, but it's not enough to prevent or limit the spread of COVID-19. Let's continue to follow all government guidelines and follow all precautionary measures to ensure that we do not spread COVID-19 and also limit the spread as much as possible. And also go out there and get screened for hepatitis. If you have questions, inquiries, send it to okibenkem@gmail.com or ntlagos10@gmail.com, or send a text only to 07060865487. Remember that COVID-19 is real. Take responsibility and stay safe. My name is Nkem Okibe. See you next week.